and clinic nurse Kathleen Surdenik. Good morning.
Good morning. Thank you for having us.
Yeah, welcome back.
Yes, thank you.
Happy STI Awareness Month.
That's right. Yeah.
It's STI, not STD anymore, right?
Correct. Yep. So they're infections, not diseases. So most of them can be cured. So.
Very good.
We want to sound nicer. So take the stigma.
What would you rather have, an infection or a disease, Bart?
Infection.
Very good.
That's right.
Yeah.
That is true.
And that's we like you said, want to take away that stigma. We want people to get tested. You know, it's happening. We recognize that. The community recognizes it. So if we can at least make sexual activity a little bit safer.
So not only is it STI Awareness Month, it's Public Health Week.
Yes.
Well, thanks for being in public health.
Yeah.
You're both nurses.
We are. Yep.
And with the week and the month, what's the opportunity that you have as health professionals in public health?
Yeah, so for Public Health Week, it's really just bringing awareness to the community about what public health does. I mean, we're kind of your stereotypical public health workers as nurses, but really there's such a wide variety of what we provide. We have home visiting programs. We have our WIC program that provides the extra nourishment for moms, babies, young children. We have our health educators that go out into the schools. They provide a lot of extra education, hand washing, vaping, anti-vaping education, exercise, just physical health overall. Our teen pregnancy prevention programs. We have environmental health, so making sure our restaurants are safe, you know, tattoo parlors are safe, public pools.
You guys are impacting a lot of people in the community, and a lot of people just live their daily life without even knowing that public health exists.
Yes,
isn't that?
yes.
So what can the community do to impact public health in a better way?
I would say just kind of familiarizing themselves with the health department and the services we offer, just because, you know, we are reliant on public funding. We're completely grant funded. And so just making yourself aware that, you know, we're not just those big controversial topics. We do a lot more for our communities as well.
Kathy, what is some of the things that you focus on as the clinic nurse?
The clinic nurse, I do sexual health and immunizations. So I give the kiddos vaccines, and then I just help people with sexual health concerns, whatever that may be.
She does our TB testing as well.
Yes, I do TB testing.
Your team has created a video, I understand,
Yes.
that features.
I've seen it. It's very good.
Yeah, so this was one of our health educators, was the mastermind behind this. So you'll get to see lots of our different employees in different areas.
Well, let's take a look.
We're the health department. Of course, we're always just drowning in paperwork.
We're the health department. Of course we drink pasteurized milk. Have you heard of HPAI?
We're the health department. Of course we walk during our lunch breaks.
We're the health department. Of course we provide free condoms. Vasectomies and hormonal birth control do not prevent sexually transmitted infections.
We're the health department. Of course we have lots of healthy recipes for you.
We're the health department. Of course we're judging you for not washing your hands after you use the bathroom.
We're the health department. Of course we want to support healthy pregnancy outcomes and early childhood development.
We're the health department. Of course we let the students use the bathroom.
We are the health department. Of course we're in all the schools screening hearing and vision of the students.
We're the health department. Of course we have a wall of WIC-approved foods to help you shop smarter.
We're the health department. Of course we're making sure your water doesn't have this in it.
We're the health department. Of course we rebrand vegetables with fun names for kids with the help of our sidekick, Lana the Iguana. Can I interest you in some boulders and trees pasta salad?
We're the health department. Of course we engage teens in talking about high-risk behaviors.
We're the health department, so of course we give free marijuana lock bags because we know that marijuana use is not safe, and so we want to make sure that families are keeping these products away from their little ones and pets as well.
We're the health department. Of course we do desk push-ups.
We're the health department. Of course we have a bunch of pamphlets that we want you to read that we know you won't, but we hope you do.
We're the health department. Of course we hand out Narcan to our community, saving people one nasal spray at a time.
What's my line?
I want to get a job over there.
Right? Come on over.
One thing I noticed was you guys have a wonderful restroom. Is that a public restroom?
It is.
It is?
And they let students use it.
I'm always looking for
No, so that one's out at Concord, though. That one was the school wellness
I'm
program.
always looking for a new
The
public.
hand washing one was public.
Okay, very good. Very,
But
very
I think the women's has a little bit better hot water, so sorry.
And a lot of the population, you guys are helping. You know, if you look at some of the percentages with WIC and teen pregnancies,
Yeah,
I mean,
we have a lot of impact.
a lot of
People don't
community
realize it.
members are in those categories.
I think during the pandemic we saw, did we see, it was when we saw a spike in STIs?
Likely, but there was less testing going on.
Right.
So our numbers for STIs overall have gone down within the last couple years, but we don't know if it's due to, hopefully it's because we are getting this education out there, that prevention is there and people are being, you know, preventative and treating themselves as needed or getting their partner's treatment, but we also don't know if maybe they're just not getting tested as often too.
So it's a tough conversation, but of course important. How do you encourage that even to occur? The conversation in a school, in a family, among people that you encounter. How do you start that?
I just start just by being open. I mean, we gotta have open conversations. They might be embarrassing or taboo, but we gotta start somewhere because sexual health is part of our health. We would go to a doctor for our heart, why not for our sexual health? And if you have concerns, let's just talk about it. I mean, I think just being open-minded and just starting a conversation with anybody and just ease them. And I'm friendly, so I try to make them just feel at home.
And education is key.
Yeah, exactly.
And that's where, if parents aren't comfortable having these conversations, we are available as a resource, so we can help initiate those.
And do you do testing?
We do. We do testing, so we can test for an array of different things at the health department. If it's something we don't offer, I will send you in the right direction, give you the resources where you can go get tested, because we don't offer everything at the health department, but I will just point you in the right direction.
You can always call or check out the health department website. Tons of information, tons of resources available, and of course you can stop by for any of those fun services that you mentioned in that video.
And with STIs, you can't treat them yourselves.
Not at home.
No,
but
no.
Kathy can provide treatment
I
within the health
can.
department for a very low cost. Yep. So
we do have some medications on hand, and I can treat you and get you on your day.
she can treat your partners too without them coming in if needed. So
Do you do like contact tracing with STIs?
for certain things, yep, certain ones of the infections. Typically more HIV focused. We do help clients when they are positive for chlamydia and gonorrhea or others. We do help them, contact their partners if they're willing to give us that information.
Awesome. Well, thank you guys so much for being with us on the morning show.
Thank you for having us.
Yeah, and we invite everyone to check out the health department website and social media for more information. Thank you guys again.
Thank you.
More of the show right after this quick break.